Hi, I'm Jim Friedlander. I'm an orthopedic surgeon at Johnson Memorial Health. Really looking forward to the new facility, state-of-the-art equipment, easier patient access to the office space, the office flow, parking's closer, and it's new. I really enjoy working for Johnson Memorial Health. People that work here make it special. It's a small hospital, and because of that, I think we deliver a very good care.
From my own experience, I was a vascular specialist in my earlier years of practice, and so I can draw upon that experience to help identify those patients that have particular circulation issues. It could be arterial, which is the blood flow in, or venous, which is the blood flow out. One of the unique aspects of our clinic is that we have a focus on vascular issues. And because that has become such a prominent part of our practice, we actually have a ablation program where we can deal with the problem so that we not only diagnose but can deal with the issue which is underlying and causing them to have chronic recurring wounds on their legs.
A woman may choose a midwife to be a part of her prenatal experience and birth process because she feels that a midwife would allow for more personal interaction, and midwives typically spend more time with women either in the office for prenatal visits or during the birth process. I am passionate about caring for women from young adolescents to older women, and being a part of their birth process is one of the more exciting aspects of a woman's life, and I think there's nothing more amazing than to be a part of that.
My name is John Shorter. I'm from Smithers, British Columbia, Canada. I had a snowmobile accident. Because of that, I've got shattered calcaneus as well, which kind of transpired into a whole bunch of foot problems over the last 5 years. I have a friend in Smithers that for the last probably 3 years was talking about Dr. Parmenter. Kept saying that I should probably come down here and have a consultation, and after probably 2 to 3 years of having these recurring foot problems, I took his advice and came here, and I'm very happy that I did. Back in Canada, the solution was to amputate my great toe. I finally got the whole puzzle solved because Dr. Parmenter diagnosed it and fixed it, so very grateful, yeah. For the last few years, I haven't been able to travel, especially to tropical countries, because I've been fighting an infection and it's been an open wound. Now I can resume exploring the world and back to work and getting back to the things I like to do, fishing and out in the mountains and hiking, and so it's going to be fantastic now, yeah. I want to just say thank you very much to Dr. Parmenter for saving my great toe, for one. Very grateful. Thank you.
Welcome to Windrose Health Network's County Line Health Center. Located on the south side of Indianapolis, Indiana, near Community South Hospital, our facility is on South Point Drive, just off of County Line Road, about 0.6 of a mile west of US 31. With family medicine physicians, nurse practitioners, and a pediatrician on staff, our County Line Clinic can take care of your whole family. From your newborn baby to your elderly grandmother, our board-certified clinicians can care for them all. Do you have Medicaid or HIP 2.0? WHN is happy to see you. Don't know if you qualify? Make an appointment with our eligibility navigator to see if you qualify. No insurance or a high deductible health plan? WHN offers a sliding fee discount based on your income and household size. We also accept most commercial health insurance plans, most traditional Medicare plans, and we're currently accepting new patients. Need an appointment today? Call early for a same-day appointment. WHN believes that your doctor is best suited to provide care for you and sets aside appointments each day just for that purpose. If we can't get you in to see us today, our County Line Center also has a walk-in convenient care center to take care of minor medical issues and other little inconveniences. Windrose Health Network County Line, proud to serve as a medical home for your entire family. Call 317-884-7820 to schedule an appointment today.
I want a place where I know we're getting the best possible care. For me, my daughter, and maybe someday her daughter too.
A healthy new day is coming for our women and children. Hancock Women and Children. It's a place just for you.
I think the strength of the services that we provide here really revolve around our genuine interest and compassion for our patients. I think our patients will be treated as family here. Together we can come up with goals and help our patients meet those goals through the services that we provide. So without that key component with compassion and concern to get our patients back to their lives, I think this program wouldn't be as strong as it is.
Stroke certification verifies that we can provide stroke care to our patients here close to home. The sooner you arrive at a stroke-ready facility, the sooner you are eligible to receive clot-busting medications that can greatly decrease the disability of stroke in the long run. Since we've become stroke certified here at Johnson Memorial Health, it's obvious that our emergency medical services are dedicated to getting your family members here in a timely fashion.
Our patients often refer themselves to our clinic, but the vast majority are referred by their primary care physicians. Our goal is to extend the care that has been given them and to help them understand the importance of having a long-standing and cooperative interaction with their primary care doctors because they have a greater awareness of the multitude of medical conditions which may have come together to cause their wound problem. And so we do not want to become the primary givers of these patients, and for that reason we always try to link them back with their primary care physician, and if they don't have one, to identify resources that are available in our community that might be a benefit to them.
Hi, my name is Allison Doris. I'm a women's health nurse practitioner and certified nurse midwife here at Johnson Memorial Women's Care Group. I have been in OBGYN for 37 years. I am honored to be a part of this practice where I can serve both as a women's health nurse practitioner and participate in birth of babies. I am privileged to be a part of the birth process, and as a certified nurse midwife, I am always excited to be present, what I consider to be one of the greatest miracles of life, and I like nothing more than to see a woman feel completely empowered by her birth experience.
I'm Dr. Matthew Parmer, and I'm a podiatric surgeon, and I'm certified in reconstruction surgery of the foot and lower leg, certified wound care and hyperbaric medicine with the Prime Monroe Medical Specialty Group here at Monroe Hospital. Well, a recent patient came down from Smithers, British Columbia, that was in a high-speed snowmobile accident with multiple injuries, and he had spinal damage. So he lacks nerve proprioceptor fibers or nerve sensation to protect the foot. He developed a long-term wound that they couldn't heal up there, and they were going to amputate into the arch of his foot. And some outfitters that had known the research work I'd done with Cook told him about us, and he came down here for surgical intervention. And we ended up repairing the bone with an implant system, and then we used a xenograft, and we were able to get rid of the infection with the implants, and the xenograft that Cook developed in 2000.
I want to just say thank you very much to Dr. Parmenter for saving my great toe, for one. Very grateful. Thank you.
Hi, my name's Cheyenne, and I'm a certified medical assistant here at the Women's Care Group. I was actually a patient of Dr. Norris, and I really enjoyed the care I got here, and it was a good atmosphere, and I knew it was somewhere that I would want to work. My favorite thing about working at this office is that all of the staff is really close, and we provide really good care to our patients. We get really personal being able to see them very frequently, go through their pregnancy with them and see them afterwards, and just being able to provide them the support that they need. If you have questions about any breastfeeding support during your pregnancy, we offer Great Expectations as a free prenatal class that we do once a quarter during the year. So we can answer questions about anything during your pregnancy or any breastfeeding questions that you have. And then once we see you for your postpartum visit in the office, if you're having problems with baby latching or questions about your milk supply, after the doctor sees you, I can come in and help you with any questions that you might have.
Lung screening is very important, just like in the past, colonoscopy and mammograms have reduced the incidence and deaths associated with colon cancer and breast cancer respectively, as we have found out recently that there are more deaths and people affected with lung cancer than colon cancer and breast cancer combined.
Why did I pick Hancock Women and Children? This was where my son was born. You know, it has to be someplace special.
A healthy new day is coming for our women and children. Hancock Women and Children.
I'm excited about this new facility primarily because it gives me an opportunity to work with two very experienced board-certified orthopedic surgeons, and we're able to offer our patients a service that you typically do not see in one facility. Many of the patients that I see will have chronic pain that may actually emulate or seem to be an orthopedic injury and vice versa. So to be able to have a resource right in the office with me, it provides a multidisciplinary approach that will allow us to get the outcomes that we want for our patients and to get the patients to reach those goals and to reach that quality of life that they'd like to see.
Interventional pulmonology is a newer field, which is a branch of pulmonary medicine, and it deals with advanced procedures related to many lung disease. It helps in diagnosing multiple conditions and as well as treating benign as well as advanced malignant conditions, all through minimally invasive procedures which in the past would have required much more severe and complicated surgeries.
My name is Joey Hollis. I'm the Emergency Department Manager and Stroke Coordinator at Johnson Memorial Health. In partnership with Franklin Schools and the school nurses, we're providing education to students grades 5 through 8. Our education for the community includes a day at the fair. We're providing the students with information on the FAST acronym and what they can do to help others that are having stroke-like symptoms. We're excited about this new accreditation because we can provide excellent stroke care to patients here at Johnson Memorial.
What makes my job exciting is seeing patient outcomes, especially when you had a patient that has had a problem for over 10 years. And after an evaluation, you know what the problem is. In fact, we've had patients that have been to many other centers and they did not have an answer. But to have an answer with something simple like an ultrasound and to actually treat the problem and to see the outcomes is truly amazing, and it's really what makes my job exciting.
The time to listen. I don't like to be rushed. My health is important.
A healthy new day is coming for our women and children. Hancock Women and Children. It's a place just for you.
Hi, my name is Dr. Carrie Smith. I'm an OBGYN physician here at the Johnson County Women's Care Group in Franklin, Indiana. After residency, I was looking for a job in the area. My husband and I live on the south side with our 3 children. And when I was looking at area hospitals, I just fell in love with Johnson Memorial Hospital. I fell in love with the hospital because it's really different from some of the larger hospitals in the area. You really feel like a family. Not just here in our clinic here where we see patients day in and day out, but over at the hospital working with the staff on the unit and all of the nurses. It just feels like a family atmosphere. What's most important to me is the doctor-patient relationship, and for most situations it starts in the office. So I do love office because at that point we're meeting each other for the first time, and then we can continue on with your care and getting to know each other better and better. It's just very rewarding to be able to help somebody out, and in some cases delivering a healthy baby, the immediate gratification of that is just awesome.
My name is Dr. Jacqueline Chang. I am a family medicine practitioner at Windrose Clinic. I've been living in Indianapolis for 3 years now. Originally, I'm from Canada. I grew up in Vancouver, British Columbia. Also spent a long time living in Toronto, in Ontario. Came to Indianapolis originally for my family medicine residency training, and very much enjoyed the city, met a lot of good friends here, so decided to stay on to work here afterwards. I really enjoy family medicine because I believe it allows me to provide preventative care for my patients. I think preventive medicine is very important in order for a person to achieve good health, because it's always going to be easier to prevent something from happening than to have to fix the complications after it's already happened. I chose Windrose Health Clinic because I first learned about it during my obstetric rotation when I got a chance to rotate here clinically. I got a chance to meet a lot of the staffs here, as well as work with them on a daily basis, and found out that it's a very happy place to work. Everyone is very helpful to each other, very nurturing environment to learn. I think I enjoy most about coming to work when I realize I am making a difference in my patients' lives. I truly believe that brings me the greatest joy. I'm very passionate about preventative medicine So one of the things I always tell my patients before they leave the room is to try to maintain an active lifestyle and make good dietary choices in order to keep their health and prevent chronic diseases from happening.
The reason why Columbus Regional Health program differs from the other programs is because we have this multidisciplinary lung nodule review board, which consists of 5 different specialties, including radiology, pulmonology, cardiothoracic surgery, radiation oncology, and oncology. And all the doctors from these specialties sit together every week and then review the CT scans from the patients who have had any kind of suspicious lung nodule or any lesion show up on their CT scan. And what we are doing basically is reviewing the CT in detail and also putting our recommendations from all the different specialties in one, and then letting the primary care provider or the referring provider know about our recommendations, which basically lets patient get an opinion of 5 doctors of 5 different and very advanced specialties without even going to the clinic or going out of their home, and then just by getting a CT scan.
I need a place that has great care for the both of us.
A healthy new day is coming for our women and children. Hancock Women and Children. It's a place just for you.
I'm excited about this new center for a couple of reasons. It's going to be the first time we're going to have our outpatient rehabilitation services and our orthopedic physicians, surgeons, and our pain specialists under one roof. Before this new center, a patient would show up in either our orthopedic surgeon's office or our pain specialist office, and they'd get a referral for outpatient therapy, and they'd have to go to a different building. But now they're going to be able to come here under the same building and receive all these services for the convenience of our patients. The second reason I'm excited about this new center is for our employees. We're going to be able to expand our employee wellness program, and they're going to be able to come over here 24/7 at their convenience and use the equipment in the facility here to help expand and improve upon their wellness goals. I would like to personally thank all our stakeholders and employees who gave us the ability to make this happen.
Hi, I'm Rick Kester, Vice President of Clinical Services, Johnson Memorial Health. I'm excited about this new building because we've put so many things under one roof. I have a great orthopedic team, a great pain specialist, and also incredible therapists all practicing in one really incredible building. It's beneficial to the patient primarily, so hopefully a patient could come here and get most of their musculoskeletal needs done in one place. They don't have to haul all over town or head to another city. It's all done in one building. If something hurts, if something's not right, if you're a weekend warrior, if you've had an accident where you need to see an orthopedic specialist, if you need to see a pain specialist, or even the therapy team. You know, we have great therapists that can take care of everything from head to toe.
I'm Larry Hayden, President and CEO of Johnson Memorial Health. Here at JMH, we're very pleased that our award-winning emergency department has recently received accreditation as a stroke-ready certified center by the Healthcare Facility Accreditation Program. This accreditation confirms that Johnson Memorial is providing high-quality stroke care to our community based on proven processes and other rigorous requirements. I'd like to congratulate Dr. Jefferson Qualls, the stroke program's medical director, Joey Hollis, the program's coordinator, and a full team of physicians, nurses, and other professionals that have enabled this prestigious accreditation. Through their efforts, Johnson Memorial Health is now more ready than ever to provide acute stroke care on a more timely and local basis. This in turn allows for reduced risk of long-term damage from a stroke, and more importantly, allows for saved lives.
The Wound Healing Center at Johnson Memorial Health offers one of the most comprehensive vein programs in the state. If you're experiencing leg symptoms such as swelling, skin changes, varicose veins, don't hesitate to inform your healthcare provider and visit our website at johnsonmemorial.org.
I am Dr. Danielle Broshears, and I'm a pediatrician. I am born and raised in central Indiana. I went to school in Indiana as well. I attended Hanover College, and then I went on to Indiana School of Medicine, and that's when I moved to the south side of Indianapolis, and I've established my family here as well. I've always known I wanted to be a pediatrician for as long as I can remember, but as I got older, I realized I wanted to do pediatrics. One, I love kids, and two, I realized that they really need an advocate. They don't always have control of their situation and surroundings, and they need somebody really looking out for them. I've worked for Windrose Health Network for about 7.5 years now. I really love the team that I get to work with, everybody from the nurses to the front office staff. If there were one thing that I could tell the parents of my patients, it'd be that we're a team, we're in this together. So if there's something that you're worried about, call me, bring your child in. I'm more than happy to work with you and we'll figure this out together.
My name is Dr. Mosier and I'm a pediatrician. I grew up in a small town in Kansas, being very involved in sports and academics. When I went to high school, I enjoyed tutoring younger children and also helping them be active in the community. Throughout medical school, I realized that children were who I wanted to care for the rest of my life, so I decided on pediatrics. I was fortunate enough to be influenced by a number of coaches and teachers that helped shape my life in a positive direction. One of the reasons I chose to work at Windrose is the atmosphere. The atmosphere is so special. Everyone from the nurses, to the back office staff, to the physicians, and to the executives work so hard at their jobs every day just to do what's right for our patients. I love coming to work every day. Anytime I can see a look on a patient's face or a parent's face that I helped them find a way to a healthier lifestyle, that brings me joy. If I could impress one thing onto parents, it's that I can only do so much. I believe in a partnership between parents and myself to help their child learn how to live a healthy life.
We are strong. We are caring. We are wives. We are families. We are mothers and daughters. We are your neighbors, coworkers, and friends. We are new mommies, babies, and big brothers. Now, a new place is on the way. A place that specializes in healthy women and children, that nurtures and treats women at every stage of life, and cherishes and cares for children.
This is a place just for us. Hancock Women and Children.
The way we designed the building was not only for first floor and second floor flow, but in between disciplines and then in our own disciplines. So this building has PT, OT, and speech. And one great thing, we gave speech their own therapy suite. So they're behind a closed door for the privacy that anybody would need, whether it's speech and language issues or swallowing issues. And then also the speech therapists here are capable of treating from infant all the way up to mature adult. And we have 6 different treatment rooms to focus on different speech needs for all of those patients.
Hi, I'm Dr. Ryan White, Emergency Department Physician at Johnson Memorial Health. Today I want to talk to you about ways you can reduce your risk of stroke starting today. Stroke is the 5th leading cause of death in the United States and the leading cause of adult disability. But there is good news. Knowing how to identify a stroke, getting quick treatment, and knowing the risk factors can reduce the impact of stroke. Risk factors include hereditary, high blood pressure, other heart disease like AFib and coronary artery disease. Other risk factors include high cholesterol, sleep apnea, diabetes, circulatory problems, and for women, hormone levels, especially estrogen, can all play a role in stroke risk. Discuss these risks and start now to create a plan with your doctor. Things you can do on your own include stop smoking
Watching what you eat, maintaining a healthy weight, being physically active, and drinking less alcohol. Every step counts.
Hi, my name is Christina Pryor and I am a certified medical assistant at the Women's Care Group. A medical assistant will be the one to call you back primarily from waiting room, check you in, we'll do vitals and history with you. We'll go over any complaints you have for the day, kind of run through your chart, make sure medicines, allergies, family histories, all that important information is in there. Get you prepped if needed, set up, ready for the doctor, whatever needs done, and then we'll get the doctor in to see you. I chose Women's Care Group because I truly enjoy my job. The providers are awesome, co-workers, it's like a big family. Really enjoy my patients, and just really like doing what I'm doing.
We're really excited about our new building. We've got an open floor concept, better lighting, new equipment. I think it'll make for a better experience here at JMH.
My favorite part of being a nurse at Women's Care Group is just being there for all those pregnant moms and helping them bring those new bundled joys into the world. At Women's Care Group, we want you to feel comfortable, confident, and empowered.
I feel very fortunate to have the opportunity to work in a facility that has everything all in one building as far as physical therapy, being able to see orthopedic surgeons that can take care of all your musculoskeletal needs. As a board-certified orthopedic surgeon and also a fellowship-trained physician in sports medicine, I really like working with all ranges of athletes, whether they're weekend warriors or a collegiate competitive athlete. We take care of the young and the old, and any musculoskeletal problems that you might have. Come check us out.
When a couple's trying to get pregnant and not successful as quickly as they would hope, that can be a very anxiety-provoking and stressful time for them. And we see patients in the office with that complaint often. You know, we really have to take each situation on a case-by-case basis, looking at their age, if they've had children before, any other medical problems, or other potentially contributing factors. Best suggestion I would have would be to contact your doctor, come in and get seen, and we can really take a look at the entire situation and see, do we just need to give yourself more time and work on timing of when you're having intercourse and to make it the most effective, or does further workup need to happen? So that's going to be best determined by just coming in and speaking with your physician, and they'll take it from there.
I feel very fortunate to have the opportunity to work in a facility that has everything all in one building as far as physical therapy, being able to see orthopedic surgeons that can take care of all your musculoskeletal needs.
Really looking forward to the new facility, state-of-the-art equipment, easier patient access to the office space, the office flow, parking's closer.
And we're able to offer our patients a service that you typically do not see in one facility. It provides a multidisciplinary approach that will allow us to get the outcomes that we want for our patients, and to get the patients to reach those goals and to reach that quality of life that they'd like to see.
Hi, I'm Nikki, and I'm a nurse for the Women's Care Group. The most rewarding part of my job is knowing that I help patients every day, whether it's maternity patients or just GYN patients, knowing that I've made their day a little better or helped them in something that they needed help with. I really like working with my front office because they are very friendly, upbeat, just nice people to be around. And then of course, all the doctors, they really are very personable, and it's just great. They're great people to be around. The Women's Care Group is a great place to be a patient. I should know. I am one.
If you have neck or back problems or knee or shoulder problems, if you've seen your doctor for these things, there's things in therapy that we can help you with this. We'll develop a plan with you in mind and get you back to your normal level of function.
My name is Tammy Holm, and I'm the practice manager for the Women's Care Group. We have been serving women in Johnson County for over 25 years. Whether you're a college student wanting to start birth control, or you're a newly pregnant patient looking for an OB, or you're somebody approaching menopause, we're here to help you in any way possible. To schedule an appointment, call 317-738-0630, or if you'd like to request an appointment online, visit johnsonmemorial.org.
Hi, my name is Andy Wendling. I'm a physical therapist at Johnson Memorial Hospital. I'm really excited in the new facility for all the extra space that we have. We're going to be able to see a lot more people and do a lot more things with it. The new equipment that we have here is going to be really nice, a lot of state-of-the-art, top-of-the-line equipment. I really like to work with people that have orthopedic injuries, whether they were hurt on the job or on the athletic field. Some of these patients have had surgery, some have not. But I really like to help them start from where they're at, where they're not really happy with life, and restore them to a point where they're very happy and back to their prior level. It'll be very convenient for the patients as well, because it'll be a one-stop shop for them to get their orthopedic care and their physical therapy in the same facility. If you have neck or back problems or knee or shoulder problems, if you've seen your doctor for these things, there's things in therapy that we can help you with this. We'll develop a plan with you in mind and get you back to your normal level of function.
Hi, my name is Tony Padgett, and I am the ultrasound technologist at the Women's Care Group with Johnson Memorial Health. I perform pelvic ultrasounds for GYN patients, anatomy screenings on babies through the middle of the pregnancy, and then continue growth ultrasounds throughout the entire pregnancy. I chose to work at the Women's Care Group because of the close-knit community of Franklin. I knew that I would be able to build a good patient ultrasound technologist relationship with each one of my patients.
Before this new center, a patient would show up in either our orthopedic surgeon's office or our pain specialist office, and they'd get a referral for outpatient therapy, and they'd have to go to a different building. But now they're going to be able to come here under the same building and receive all these services for the convenience of our patients.